Thank you for joining us today. Thank you for joining us today for Road to Inclusive Early Childhood Care and Education event, as we discuss the importance of inclusive early learning for marginalized children, particularly those with disabilities. My name is Maria Omare, and I will be your co-host along with my colleague, Kaylee Michael.
Avec mon collègue Michael de La Réunion.
Hi everybody, my name is Katie Mycroft and we are so
Tout le monde, je m'appelle
to have
Emmanuel.
all of you with us.
Je serai avec
We have
vous.
a lot of people joining from all over the world, which is really exciting. So please introduce yourselves in the
Alors,
chat.
vous allez commencer par vous présenter.
And let us know if you are working on inclusive early childhood care and education.
Nous allons parler de l'éducation de la petite
Feel
enfance.
free to share your work in the chat.
A few important reminders. We have Spanish and French translation available for you today.
Traducteur en français.
Please click on the world icon on your screen and
Cliquez
choose the
sur
desired language you wish to hear today. We also have captioning and international sign language available for you. You can turn on your captioning by clicking the CC button on the bottom of your page, and our Also, if you post anything about this event on social media, please use Inclusive Early Childhood Care and Education, hashtag Inclusive ECCE.
So before we start, we want to go with a little activity with Mentimeter. So please follow the link in the chat to answer the question, what is the biggest barrier to making all early childhood care and education inclusive? We'll give you about a minute for you to enter your answers and then we'll share the word cloud with you.
Thank you all for your participation in the opening activity. Let's keep the responses coming. As you can see now, a lot of people believe that knowledge is a significant barrier to inclusive early childhood care and education. Funding is also coming off as a significant barrier. Our first set of panelists today will be presenting tools that can be used to address many of these barriers, followed by a group of panelists that will discuss their experiences on the ground. However, before we begin, I am honored and delighted to have Honorable Bimala Ray Cordial from the International Parliamentary Network for Education with us today to present opening remarks on why early childhood care and education is so important and why countries need to take action now. Over to you, Honorable Bimala.
Namaste and greetings from Kathmandu. Hello, everyone. I thank you very much for the organizers to providing me this important forum to talk to you about early childhood care and to share my experience from Nepal as a member of parliament promoting this issue. Let me quickly share some of my slides so that it's easier for you. Can you see my slide? Can you see my slide?
Yes.
Yes, we can.
You can. Okay. So thank you. Thank you again. Roadmap to inclusive early childhood care and education. I'm so honored to talk about it today. I will be bringing my experience. Why early years? I just want to quote the period of life is not the age of university studies, but the first one, the period from birth to age of 6.
La période la plus importante dans l'éducation d'un enfant, ce n'est pas la période d'études universitaires.
Care and educational services are very well known to the world. Investment in early childhood has huge returns for children, their families, and for societies, especially for the disadvantaged. One study shows that each dollar invested in early childhood education can yield a return as high as $17 for the most disadvantaged children. Despite of these huge benefits, actions to expand access to quality services is far below than the requirement, and inclusion is one of the major challenges of early childhood education and care. Early childhood care and education, it comprises a bundle of opportunities. It is not only education, it's about health, it's about nutrition, safety of the newborn, protection, and early learning for holistic development of children from 0 to 8 years of age. So a center should have facilities of all these sectors to ensure that the child receives early childhood care and education. Now, let me quickly go through the global state is for my understanding. The Global Education Monitoring Report this year says, globally, pre-primary gross enrollment ratio is only 61.5% in 2014. Nearly 40% children are still beyond the access. So they don't have access to ECCD. COVID-19 resulted closure of existing ECD centers. Only 9 out of 195 countries had early childcare support as part of their pandemic response. So ECD is still not recognized important during the emergencies. Only 28% of countries have made pre-primary education compulsory. That means not all children have access to quality early childhood care and education. Let me talk about funding. Pre-primary education received an average of only 2% education budgets in 2018. The pandemic is expected to push more children into extreme poverty. Again, the early childhood is not a priority for many governments, especially where there is increased expenses on COVID-19 control and recovery. So funding is an issue. The issue is early childhood is underfunded currently, and the situation is worse during the COVID-19. Let me quickly share with you what we are doing in Nepal. The formal early childhood development approach in Nepal started from early 2000 with different modalities. We have school-based and community-based modalities. We have public and private funded early childhood centers. Since 2000, a total of about 37,000 early childhood centers have been established throughout the country. Number of children enrolled has increased from 12% to 86%. So this is a very good achievement that we have in access to ECCD, but we do have some challenges and some issues. Coverage and access is one of the most important issues that we have. The ECD centers are more concentrated in urban areas, the remote villages, poor children, and children with disability and other disadvantaged have very limited access, especially children with disabilities do not have facilities needed for them. The quality of facilities and services varies very greatly. Affordability, not all children and parents can afford to good quality services. There is a lack of standardization, so wide variation exists in terms of skills of facilitators, in terms of tools and methods used, and in terms of overall quality. We also face challenges related to human resources. We do have inadequate level of human resources for early childhood centers facilitation. So what is the role of parliamentarian in ECD promotion? We do have some experience from Nepal. Parliamentarians in Nepal, we have formed ECD Caucus. This is a loose network of member of parliaments to promote ECD. The caucus was formed when constitution was being drafted. Objective was to lobby and ensure that constitution recognizes early childhood care and education as fundamental right of children, and this is met. Constitution has now recognized ECD as one of the fundamental right of children. Education Act has included early childhood as free and compulsory for young children. All major political parties have prioritized early childhood in their party manifesto. National strategy has been developed, and federal government continues to integrate ECD into relevant legislation and other sectoral policies, plans, and budgets. So we have made some progress. Caucus is now focused on oversight and ensuring that inclusion issues are addressed in ECD. We continue oversight. We continue lobbying for political commitment and to increase budgets at federal as well as province level. We are still lobbying for a separate law that promotes holistic approach and ensures universal access to quality centers. We are working for some kind of standardization, but also without compromising value of diversity. We are engaged with province assembly members to internalize and mainstream early childhood development concept at province level in laws, policies, programs, and budget. We are also forming ECD champion group at provinces so that the ECD is taken into priority. I have attached a separate note for detail on what ECD Caucus is doing in Nepal, which is basically the parliamentarians doing in Nepal. Despite of these efforts, universal access to ECD is still a distant goal for us. For the way forward, I think the countries should have 4 priorities now. The first is to make a commitment to a standard model and to its implementation nationally on the basis of universal provision, so without compromising the universal standards. Countries should also address the barriers to inclusion as part of the commitment to quality. We vary in our socioeconomic situations, and therefore we vary greatly in terms of barriers. So we need to be context specific, identifying the barriers and addressing them. We should also increase financing. It is important. And then we need to grow political understanding of and commitment to early childhood care and education. In this occasion, I was also thinking whether we can think of establishing a network of parliamentarians in the region for regional level integration and oversight. Because in Nepal, the loose network of parliamentarians has been very, very effective to promote the issue of early childhood care and education. So I think if we promote regional networks or the global networks of parliamentarians, it really works. So this much that I can share with you. I'm very happy to answer queries if you have. Thank you.
Thank you for your presentation, Nima. I think a couple things that stood out for me in that presentation is how important a holistic approach is to ECCD, and universal access has to be the big goal. Because there's so many marginalized groups, and everybody deserves access. So thank you for your insights. Now we would like to open the floor for any questions. You can also put your questions into the chat. So
I see one question.
Yes.
Yeah, can I? Okay. I see one question, that is, has government put in place the institutions that train ECD teachers? Yes, we do have, but that is not sufficient. We have CTEPT, we have a 6 months training course, but currently we don't have a standard method and standard process that is mandatory for, that requires, you know, all facilitators to be trained and get certificates. So basically the NGOs are also giving training. Government also has some kind of training, but this is not reached to all. So that's Q&A as well. Okay. So let me see the Q&A. Okay, there is a question. Good to learn how Nepal's policymakers are taking ECD on board. What was the drive or motivation behind their commitment? Actually, when the Constituent Assembly was formed and we were starting drafting the Constitution, the MPs realized that the Constitution Assembly was very much inclusive. All types of people were there except the children. And the children's voice was not coming up. Some NGOs working in the field knocked the door of a few member of parliaments, and a total of 80 member of parliaments gathered together, and they started raising voice of ECD, and they made a commitment that they will ensure the incorporation of early childhood in constitution. So constitution drafting was the major, you know, motivation to work together for MPs. Once the constitution recognized early childhood as a fundamental right to children, then the issue was how to implement them and how to make laws related to ECD again, because constitution cannot be implemented without laws. So we started again, you know, following up with the government, and now the policy framework is good. Now the issue is on implementation, oversight, and standardization.
Thank you, Honorable Bimala. Let's keep the questions coming in the Q&A section for her to respond to. We are now going to transition over to Zacharias Sikai, who is a country director at Light for the World, who will be sharing recommendations from the study, Leave No Child Behind, Investing in Early Years. Over to you, Zacharias.
Thank you so much. My name is Zacharias Sikai. I'm the country director of Light for the World, and I'm joining from Beira, Mozambique. Next slide, please. Light for the World, in partnership with Open Society Foundation, we conducted studying for African countries. And the focus of the study was to examine donors' spending and commitment for the 3 key areas: early childhood development, inclusive early education, disability inclusive early childhood development. And from this study, we got 3 key messages, which we want to share here, which is ECD is massively underfunded despite commitments and overwhelming evidence of its transformative power. Vulnerable children, particular children at risk of development delays, and also children with disabilities are being left out, and the investment levels are not at the stage that can ensure the inclusive ECD for all, and ensure that the children don't just survive but thrive. And if you, next slide, please. And if we look to the study analyzed 10 donors, and we can see that the disbursement to this subsector are alarmingly low. And we can see that 4 donors spend less than 1% of their total education budget. Also in average 1.8% is channeled to education, but only UNICEF is the one donor that spend 8.3%, which is very close to the target of 10% of the order to education. Looking to the 4 countries, Burkina Faso, Mozambique, Zambia, and Zimbabwe, we have seen that the donors favor the health subsector and a lesser degree to the nutrition subsector, and they give more priority to disease-specific programs and child survival programs. And also in the 4 countries, there have never been developed and fully implemented a multi-sectoral early childhood development policy or strategy. And there's somehow some misunderstanding about ECD as a primary education only. Therefore, early intervention programs, workforce development, and multi-sectoral collaboration is totally neglected. So this kind of confusion also explain how the governments are channeling the fundings, including the donors. I would like, next slide, please. I would like to share the specific findings of the research on Mozambique. And in Mozambique, where 61% of young children are at risk of poor development, only 4% of young children have access to some ECD services. And also, due to the COVID-19, there's a lot of increase of risk of more children having development delays. And the government strategy on the preschool and child development is not making provision for children with disability, which represent 14%. And the government is giving more priority to protection, primary health care, nutrition, and vet registration, and parenting classes for the caregivers. And the conclusion is that provision of and access to quality ECCE service in Mozambique is rooted in which is rooted in nurturing care principle is still low. And this is because that the government, including the donors, they're not channeling enough funds. They're not investing, they're not financing programs on ECC in the country. Next slide, please. And the recommendation that the study brought is that providing, there's a necessary to provide the necessary finance to scale up inclusive ECD services, and which includes debt cancellation to free up domestic resource. And we believe that with cancellation of the debt can maybe scale up and can allow the government also to increase their funding. And there's a need to prioritize building up a quality preschool service that address in a holistic manner the development of all children through play-based learning. And also there's a need to develop a cross-sector ECD plan which tackles the multiple disadvantages faced by all children. So these are the main recommendation that the research brings to the government from Mozambique and also to the donors that are working in the education sector. Next slide, please. So thank you so much for listening. And I'm here to answer any questions. And I hope that through this research, we can improve the investments in these 4 countries. Thank you so much. And over to you.
Thank you so much for your insightful presentation, guys. We would like everybody to be engaging in the conversation, so please do make use of the Q&A, and Zacharias can answer your questions there.
We will now, thank you so much, Zacharias. We will now transition into the section of our panelists that will be discussing 3 different tools that can be used to encourage inclusive early childhood care and education initiatives. After all 3 panelists present, we will open the floor for questions but please feel free to type your questions in the chat as well. To begin with, we will start off with Divya Latta, Education Specialist from UNICEF. Over to you, Divya.
Thank you very much, Maria, and greetings all colleagues, friends, partners in this forum. It is really my great pleasure to join you in this session today. As Honorable Bimlaji has already emphasized right at the outset, while recognizing the transformative potential of early interventions to build inclusive systems, we do have a long way to go. But of course, as the research Mr. Zakaria presented, there are already some suggestions on how we want to move forward. I'm going to focus a little bit specifically on the education sector. And we know that pre-primary education, as has been mentioned, is a critical platform for laying the foundations of an inclusive education system, as well as collaborative cross-sectoral interventions. Guided by our SDG commitments and leaving no child behind, UNICEF and our partners strive to achieve equity in access, build inclusive systems to deliver quality, and work towards significantly increasing financing for pre-primary education. Next slide, please. To make these aspirations a reality, it is imperative to position early childhood education securely within the policies, plans, and financing and accountability mechanisms in the education sector. UNICEF and our partners have developed the ECE accelerator approach and toolkit to take this agenda forward and integrate ECE systematically into education sector planning processes, as you see in the diagram on the right side. There is also the ECE Accelerator Toolkit, which enables us to build the capacity of education systems and stakeholders at national and subnational levels. And this equips them to effectively plan for and implement ECE programs with due attention to including children with disabilities, while also promoting knowledge exchange and peer learning. Let me give you a quick overview of the toolkit, and let's go to the next slide, please. And here you will see that the toolkit is organized along 5 sections. These focus on creating an enabling environment. You see on section 1. This is targeting generating political will and the stakeholdership around ECE. Other sections focus on identifying the facts, figures, data systems that should inform policy mapping, situation analysis, and also establishing a shared vision for ECE within the education sector. It also offers benchmarks to review draft plans and then subsequent reporting on progress and so on, following the cycle of ESP planning, the situation analysis planning, and then subsequently following through the issues around validation and then reporting and review. It is noteworthy that although the toolkit is aligned around these key steps of the ESP process, it is not a linear tool, and countries and stakeholders who are using the tool can dip in and out of sections, the tools, tip sheets, etc., based on where they are in the process and as the needs evolve. Let us also take a quick look at how we can use this tool on very specific ways. So if you wanted to see resources around disability inclusion, let us see what the toolkit pulls up. If you could connect on the link, please. Yes, there we are. So just to save time, we already, there is a search box on the toolkit. This is an online toolkit, and we already put in disability inclusion. And if we slowly scroll down, we will see what this search has pulled up. So as you can see, there are some definitional tips. There are program design tools based on the principle of universal design, and also comprehensive guidance on planning inclusion of underserved groups with a specific focus on children with disabilities in chapter 11 of this comprehensive guide. This is volume 3 of the Education Sector Planning Guide, which is used around the world by governments and stakeholders working in the education sector. And the latest volume 3, in fact, focuses very substantively on inclusion of children with disabilities, including at the pre-primary level. In the interest of time, let's go back to the slideshow and focusing on the last slide, we would invite you to explore the toolkit. UNICEF hosts this toolkit on the toolkit website, but it is the result of contributions from several partners to whom we are very grateful and we continue to work with. The link is there in the chat box, so do explore the toolkit. It is a living toolkit and it will grow with your own experiences. So do explore it, use it, and let us know what works, what doesn't work. You can use the Contact Us tab on the online site, and we would love to hear from you and also showcase your stories as we move along on this journey together. Let me stop there and hand you back to Maria. Thank you very much.
Thank you so much, Divya. We're now going to transition to discussing the Brookings Institute costing tool. Unfortunately, Emily Gustafson-Wright is traveling at the moment and had some unexpected connectivity issues, but thankfully we have Sarah Osborne with us today on her behalf. So over to you, Sarah.
Thank you very much. It's a pleasure to join you this morning to present about, thank you, Krista, for the slides, to present about the Brookings Early Childhood Development and Education Costing Tool. Emily sends her regrets that she's not able to join us this morning, but please do feel free to be in touch with either of us following the presentation with any questions. Next slide, please. When it comes to something like costing and financing is, we realize, not necessarily a familiar topic to everyone. And so we wanted to start with a question, which is, why should we be collecting cost data or caring about this topic in the first place? As has been well laid out previously, investment in early childhood services is woefully inadequate. And so one of the key reasons to utilize cost data is as an advocacy tool for additional investment. As I'm sure our colleague in Nepal can tell you, as a member of government, coming to the government and with an advocacy question, it's much more effective to have a costing or budgeting line attached to that. And unfortunately, the availability and access to costing data is very low currently. And so Brookings has been conducting, next slide, please, conducting research on the topic of costing since 2014 and has published several reports and journal articles on the topic. And that culminated in a 2016-2017 development of the Standardized Early Childhood Development Costing Tool, or SECT. Next slide, please. The original version of SECT is visible in a screenshot on this slide, which is of an Excel document, which is a little bit complicated. And through piloting of the tool in 5 countries, we received the feedback that the costing tool, could be much more user-friendly and effective. However, the breakdown of the costs and the data it provided were extremely useful. Next slide, please. And so that brings us to our current work in 2020 and 2021, in which we have been developing a revised costing tool based on the original Standardized Early Childhood Costing Tool. However, this will be in an online, user-friendly format, and will have accompanying user guides and resources for users. This will be developed on the Tangerine platform, so it's a survey-based platform. And it's also intended to be used across a variety of ECD sectors, including integrated programs. It's also been expanded to include primary and secondary education as well. The tool splits costs out across a variety of cost categories and resource types and has a lot of different built-in functions of currency and inflation. We're happy to share more of those nitty-gritty details with anyone who is interested, but we'll spare you of them today. And so one key goal of the costing tool is that it will be building a database of ECD and education costs. And this cost study database will be able to include tags for marginalized populations, including children with disabilities, which will provide valuable information for future advocacy from the global community and in local contexts. The tool is intended to be used by policymakers, funders, implementers, or researchers. Next slide, please. And can be used to answer a variety of questions. In the sake of time, I will skip over these for now, however. The costing tool will be housed on a standalone public website. The images that you may see on the slide right now are just illustrative. This is actively being designed currently. And this website will house the case study database that I mentioned, and additionally will house the costing tool itself. Next slide, please. Some visualizations of the costing tool are on the screen now. And so for those who are able to see this, as it includes a number of different forms in survey format for each of these different cost categories. And we've tried to build in a lot of different functionalities to make the survey format as accessible as possible in order to balance the user friendliness that we have a demand for, while not losing some of the details that make a costing exercise very valuable. Next slide, please. So what's next for this work is that we're currently in the final stages of developing a beta version, and we're doing user testing. We'll be recruiting pilot partners to test out this tool and give us some feedback on how it could be improved in the coming months. And so if you're interested, I will put contact information and a link in the chat. Next slide, please. To the Brookings costing research and for Emily and myself, and we look forward to hearing from anyone who's interested in learning more, in particular, anyone who would like to serve as a pilot partner with us for this tool and gain a lot of interesting cost data that you can use for further advocacy efforts for early childhood and inclusion.
Thank you so much, Sarah, for that excellent presentation. Just a reminder, enter any questions you have for Sarah or Divya in the Q&A section, and they will respond to you directly. As many of us know, COVID-19 has impacted the ways that tools are implemented during this period on the ground. We will be hearing from Aisha next, who is the Education in Emergencies Technical Advisor from Save the Children International. She will be discussing how Save the Children modified their EDELA tool and as some of the lessons they have learned. Over to you, Aisha.
Hi, everyone. Can you hear me? Can you see my screen? Everyone can see my screen?
Yes.
Perfect. So my name is Aisha. I work for Save the Children Colombia, and in the previous presentations, we talked about the importance of early childhood education, the costing, and today I'm going to talk about how do we know what works, so how we can make the better investment in COVID times as well. So I'm going to talk to you about a tool that we have used in Colombia, EDELA tool. This is a direct child's assessment on child's development and learning. This is not a diagnostic tool, so we're not doing a, let's say, an individual assessment on every child. We have already piloted the tool in other countries, and the results received at the community level, like I said, this is not a diagnostic tool. So we want to see what is working at the community level. And it allows us comparing the effectiveness of different approaches, which is very important because the previous presenter were also talking about, you know, the funding gap in early childhood education, but also the importance of investment. So by using the tool, we can see what type of approach is working, what type of programming is working. So basically, in a nutshell, we're looking at 4 domains. So we're looking at motor development, we're looking at emergent language and literacy skills. For example, during our assessments, we're asking children, you know, what they see in a supermarket, and then we look at their vocabulary level. We're looking at emergent math and numeracy skills, and we're also looking at social emotional development skills. The assessment itself it's quite easy. It can be done. It doesn't require, let's say, a lot of materials. You can use any material that is available in the community. It's only a 30 minutes assessment, and it was validated several times. Now, we had an interesting situation in Colombia because we were part of a pilot project where we implemented IDELA, but we've done it during COVID times. And we've been lucky to have both remote application of the tool and also in-person application of the tool. So this is what I'm going to share with you guys today. In the remote application, which was we've done around late last year, what we have seen is that parents usually interfere with the children's responses. Although we had explained to caregivers that this is not a diagnostic tool, we have seen that during a remote application through phones or WhatsApp, parents are interfering with the responses of their children. However, when we did an in-person application using the data collectors, there was no interference. We also found that in remote application, children seem to lose their attention, especially if there are problems with connectivity. For example, in some communities, we needed to do normal phone calls because the families didn't have smartphones or there was no connectivity in the community. In that scenario, it's quite difficult to, engaging young children in a, in questionnaire. However, in person application, we had two data collectors with us who were able to engage through games with children. So we have found that the quality of data that we collected was much higher. What we also found that sometimes parents and caregivers can have a different interpretation of the question because they're not trained in the tool. However, when we used data collectors, they were already trained on the IDELA tool. They already knew, all the details about the question. So there was no differences in the interpretation of the questions. Another challenging situation that we had in Colombia is that we also worked with indigenous communities, and not all parents can read and write in Spanish. So, for example, we asked parents to draw a circle, but for an indigenous parent who only speaks Wajanaki and a little bit of Spanish, circle doesn't mean anything. So that was also very challenging because then we had to call the neighbors. Someone needed to explain what a circle is, so they explained to the child. So the assessment was basically taking a lot longer. However, when we done it in person, we already had someone who could speak Wajanaki and was facilitating the assessment for us. The biggest issue I think in any remote implementation is connectivity. We have seen that first of all, not all parents have smartphones, which means that in some cases we needed to do normal phone calls, which means in some cases explaining instructions can take a lot longer, and there's a lot of background noise. So again, it can disturb the data collection. However, when we did an in-person application, we basically selected the places ourselves, and there was no interruption of any sort. So it was quiet, and we were able to engage with the children in a lot easier way. Sometimes in remote application, it's very difficult to interpret the responses, probably because the parents themselves did not understand the question that well. However, in in-person application, we didn't have those problems because the data collectors were already trained in the tool. So one of the lessons that we have learned is, one, yes, it can work remotely, the tool itself, because it's quite simple. It does work, in a remote application, but it's important to ensure there's enough connectivity, less reliance on having normal phone calls, more on WhatsApp. And we also found that it's also important having a bit of a sensibilization with the communities and with the parents, so they don't interfere with children responses, and they also understand what we do, why we do, but we didn't, in COVID times, everything was, very hectic. We didn't really have time for that. Many thanks. I'll hand over to
Awesome. Thank you, Aisha. Super insightful. I think it's some good lessons that you shared with us, so thank you. We'd like to keep the conversation going, so keep the questions coming in the Q&A and in the chat, and Aisha can answer any of them directly there.
Thank you so much, Kaylee. Before we move to the third and final question, there is a question in the chat for Sarah from Crystal Holt, which says, what training is required for someone to use the Brookings costing tool? Can people just pick it up and use it, or how much support is required? Over to you, Sarah.
Great, thank you for the great question, Crystal. The goal for this revised version of the costing tool, which is online and survey-based, the goal is definitely that it will require very little training or support and that one could pick up the tool and use it. We will also have guidance resources which provide an overview of what's expected of the process, what data might be needed in advance, what sorts of questions one might want to ask with their team while undergoing the exercise. There'll also be some detailed information about troubleshooting. As we all know, online applications sometimes have some challenges. So especially in this piloting phase that we're about to be undergoing and the user testing, we're trying to work out a lot of those details. And so we will provide some additional support in that process live as we work on identifying where the gaps we might need to fill in are in terms of the tool's functionality or the guidance resources we're providing. However, the short answer is yes, that is the goal, is that it will be usable by a wide variety of individuals with different levels of expertise or knowledge and costing with very little training or support. But if you're interested in helping us get there, please do reach out about piloting or user testing. We'd love to hear from you.
Thank you so much, Sarah. That was a very elaborate response. Let's keep the questions coming in the Q&A section. Thank you everyone for the very active engagement. We're going to transition to the next session that will be focusing on the experiences of inclusive early childhood care and education on the ground. We want to note again that we will be hearing from our last three speakers and then opening up the floor for questions. So please feel free to write your questions in the chat. So to start us off, we have Victoria Midalauri. Victoria is the Education and Disability Advisor on Disability Inclusion in ECCE from the World Vision Australia, and she is joining us today. Over to you, Victoria.
Hello, everyone. Happy to be part of this big event, sharing so many lessons, tools, and insights to each other. I have learned a lot from my colleagues, and I hope you will get some ideas from my presentation as well in following 5 minutes. I will talk about how NGO is supporting government of Georgia in implementing ECD program. And I will mention some tools on the way. World Vision chooses twin-track approach as the main approach to include children with disability in programming, and we understand and we believe that not only making the programs or activities accessible for children with disability, it's not enough, and we believe that empower pathway is also important. So we pay a lot of attention to work with parents directly and children with disability directly, and create capacity building empowerment opportunities for them as well, so they can join any other offered activities that we offer them on the ground. So that means that we try to see every child with their individual needs, and it takes a lot of efforts and many different ways to approach this, starting from building internal expertise and building capacity of our own colleagues inside family. On the other side, we build partnerships with other NGOs working in this field, INGOs, also DPOs actively engaging with disabled people's organizations. We work closely with communities to build their awareness related to disability issues and empower them to create services and opportunities for children with disability to participate in community lives. And as I mentioned, we pay a lot of attention to empower families and children themselves, and talking about that, every initiative that we start in ECD program starts from identification of children with disability at the community level. The very early stage, we started from Washington group questions as a baseline study to identify children with disability, and later on we integrated ages and stages screening tool as part of ECD program that was used by health workers and ECD practitioners at the community level to identify children with a potential risk of developmental issues and refer them to proper services, more holistic assessment, etc. So another piece is that we start working from early stages. Like, it's not pre-primary only, as some presenters mentioned. We start from the first days, even before that. And one of the key tool that we are using is Go Baby Go tool, which focuses on the first 1,000 days of children's lives, and it's more about educating parents on children's needs and parenting skills, etc. And I will talk about learning routes, a second tool, later on, to give you more ideas on that. So we work closely with preschool and ECD center practitioners. When we don't only provide trainings, but also coaching and supervision along their working with children. So that contributing to building the strong systems around the children, including children with disability. So there are a lot of referral pathways built as well throughout the years. That means that whenever there is need for additional services like rehabilitation or early intervention services, we refer every child to other services as well, so they get holistic support at community level. And moreover, World Vision is sometimes funding different services to like start up new services in communities where they never existed, so children can get access not only to ECD centers but also early intervention centers as well as a complementary services for them. And community awareness events and campaigns like Down Syndrome Day or International Autism Day or Disability Awareness Day became like regular events in World Vision Georgia Life as well. And throughout the year, there have been developed many different tools and guidances and like books, reading materials for caregivers, parents, and children themselves. For example, I can mention one. There is a whole list of guidelines on the screen, but I will mention one that was developed particularly for pandemics, that are guidelines for preschool and school teachers, how to adapt WHO recommendation in classroom or ECD center situations, and provide safe learning and education and activities for children at home or at centers. And another one is about for children. It's an animated book that parents can use with children to explain coronavirus. It's called Nico and Nick and Virus, and they can paint the book as well. So this was one example of one country, how holistically it approaches. Just few examples because there are so many other activities going on the ground. And now I would like to talk more about learning routes, which is the key manual and tool for World Vision globally that's used to capacitate ECD centers and parents and communities around that. It consists of number of manuals for teachers, parents, communities, etc. So recently, this tool wasn't much focusing on the needs of children with disabilities. So recently it went through adaptation, and there was added number of topics that's very specific to the needs of children with disabilities, starting from the awareness piece, ending with the teaching and education strategies and adaptation of environment, etc. So anybody who will get training, like parents, ECD practitioners, etc., on learning routes, they will get also in a package training on disability inclusion, different topics on disability inclusion. And two more tools that you may be interested in, you can search more information on that. That's used globally by World Vision. It's Mecca tool, which you can download from Google Play. It's an app that helps to check, monitor quality of ECD services on the ground. So please find more information online. And also let's talk about All Children Reading Program, which is also a global initiative run by World Vision US office, which is funding different initiatives and grants to different organizations which have creative ideas how to help children of preschool age and school age to learn reading. So it's about literacy for children with disability, and different interesting play and adaptation of materials have been created throughout this program worldwide, and you can search more and maybe find some interesting tools that you can use for your programs as well from this site on All Children Reading. And that's all from my side. Thank you for your attention, and special thanks to my colleagues Edward Winter from US office and Sira Barkaya from World Vision Georgia office. And they might take some of your questions from Q&A because they are like more closely working on different topics that I have touched today. Thank you very much.
Thanks, Victoria. Really great to see all the work that's going in to really understand the different levels and the different people involved in making ECD happen. Thank you.
Thank you.
For our next presentation, we have Clement Kabirigi. He's the unit coordinator with Umbuto Foundation in Rwanda. We understand that home-based models of early childhood care and education are unique in their ability to reach children and their families from their homes. How have home-based models been used, and how has COVID impacted these models, Clement?
Thank you very much. Hello, everyone. My name is Clement Kabirigi. So I work for Umbuto Foundation as the coordinator of the education unit. Umbuto Foundation is a Rwandan NGO whose mission is to support the development of a healthy, educated, and prosperous Rwandan society. It was founded in 2001 by Her Excellency, the First Lady of Rwanda, Madame Jeannette Kagame. This is, in brief, what I'm going to share with you regarding our model ECD, our centers and home-based ECDs specifically. I will start with the reason why we invest in ECD and in children in general. It's a call from our high-level leadership. I will quote the message from our founder and chairperson, Madame Jeannette Kagame. So, a seed well planted, watered, nurtured, and given all the necessary support successfully grows into a healthy plant, one that reaches high and stands tall. So that's the philosophy that guides our work in ECD. So by investing efforts in ECD, we expect to nurture the Rwanda's next generation. ECD is a national priority in Rwanda in an effort to achieve the status of a knowledge-based economy through developing human capital. And that's part of the National Strategy for Transformation, which is a government plan for 7 years, starting from 2017. And it's in this regard that Imbuto Foundation, as a partner of the government, initiated the ECD and Family Project in 2013 to support the development of children aged 0 to 6 years in a holistic approach, and developed a model that combines or integrates 5 services into one. That's education, health, nutrition, hygiene, and sanitation, as well as child protection. The model uses different approaches. We have model ECD and centers, community ECD centers, as well as home-based ECD centers. These are 3 components that provide care and services to children between 4 and 6 years of age. And we also have the workplace ECD centers in the home visitation program, both of which provide services to families with children aged between 0 and 3 years of age. That's basically a parenting training and mentorship program to ensure that the primary caregivers, but also other members of the household, become nurturing and responsive caregivers to the children. Going in a bit deep into the home-based ECD model, it's basically a group of 10 to 15 families that come together, identify one safe space that at least meets the minimum standards to host ECD services. And the parents themselves provide care and services on a rotational basis every day, 2 by 2, to take care of the children. So the sessions follow the integrated ECD package guide, as well as the national curriculum for the pre-primary. Both of those resources also provide guidance on which kinds of toys and books that should be used in the home-based ECDs, and focus on what the parents can produce themselves from the locally available materials to ensure sustainability and cost effectiveness, which makes it easier for scale up for this home-based ECD model. Countrywide, the national target is to have at least 3 home-based ECDs per each administrative village, so that it ensures universal access to pre-primary services for all the children in Rwanda. At field level, at ground level, the program coordinates with other local structures, mainly the community health workers, the local primary schools, the health institutions, but also specialized institutions to provide services to children with disabilities. And the same institutions also develop capacities of the caregivers in that regard for early detection, for referral, the referral mechanism, and everything. So basically, because ECD is a cross-cutting program, the coordination integrates many more sectors on ground level and central level to ensure the continuity of care. In 2019, Imbuto Foundation conducted a study which revealed that 69% of the caregivers who went through these parenting sessions were likelier to engage in learning activities with their children, such as teaching their children something new, singing a song, telling stories, reading with them, against 30.8% of the parents in the control group. The same study also indicated that children who benefited from that program were likely to perform higher in primary school than the ones who did not go through that. And the results are 75.8% versus 68.2% in the control group. These are some of the program implications. Because this approach brought together different services in an integrated package, it has demonstrated effectiveness in ensuring that the children achieve their developmental milestones all together. And but also the program has been instrumental in increasing access to ECD services, especially the low-end families. And this is greatly resulting from the home-based ECD model because it's easy to replicate. The views of the stakeholders and caregivers also indicate a highly appreciative feedback and appreciation from the communities on the impact the ECD program has on the children, either in terms of performance in school, but also in the way they behave at home and everywhere else in the communities. And as I talked about it, because of being cost effective, the home-based ECD model is easier to replicate, and in an effort to ensure universal access to ECD and pre-primary services to all the children. Thank you very much. We'll pass over the floor back to the moderator, and we will remain available to answer to any questions. Thank you very much.
Thank you so very much, Clema. That was incredibly useful. Our final presentation today will be from Moses Abiero, the Program Manager at Africa Early Childhood Network in Kenya. He will be talking about what the Africa Early Childhood Network is doing to support decision makers in Africa. Welcome, Moses.
Yeah, thank you. Thank you so much, Maria, for that introduction. And also thank you, my colleagues, for a wonderful presentation that you've done. Welcome all. And I will be taking you through some building blocks for a quality, inclusive early childhood care and education, and also be taking you through how Africa Early Childhood Network is structured to support advancement of early childhood development across the African continent. As said by Maria, my name is Moses Abiero, and I work for Africa Early Childhood Network as a program manager based in Nairobi. So basically, I will be taking you through some slides. One is that globally, it is estimated that around 93 million children live with disabilities. And therefore, these children face persistent barriers to education, basically stemming from discrimination, stigma, and sometimes failure of decision makers to incorporate disability in school services. And we realize that children with disability are often not given proper attention in policy making, and therefore affecting their access to education and participation in socioeconomic activities. And therefore, there is need for increased advocacy to ensure that all children access quality, equitable, and inclusive early childhood care and education. So basically, why inclusive early childhood care and education experiences? One of them is that providing children with opportunity to enjoy living and learning with their peers, and also it promotes in them a sense of belonging and self-worth. So in terms of building blocks, one is to ensure that all children access a full range of activities and learning opportunities, and that they fully participate and engage in activities. And this can only be done if there is a strengthening of systems around staff development to ensure that this staff are trained in specialized areas, are also provided with professional development opportunities and resources needed to help all children enjoy living and learning. So basically, in terms of array of areas that may be looked at, and I think colleagues were able to allude to them, the issue of policy is very important to ensure that policies facilitate access to all children, that we provide opportunities for specialized staff training and also professional development. And at the center level, there is appropriate leadership and support to them inside and outside school so that they can be able to support and help these children live and learn through play. That also we need appropriate curriculum that also offers opportunity for early identification, referral, placement, and support, and that there is need for strengthening of evaluation, monitoring, and learning system to ensure that basically the issues of data and the issues of assessing child development and learning outcomes are addressed. And finally, to ensure that there is strengthening of governance systems, especially around adequate financing and also sound leadership that includes multi-sectoral coordination and collaboration. So basically, these are some of the three areas and issues that I've looked at in terms of need for advocacy, support high-level policy dialogues, basically that spotlights on the need for inclusive education policy and programs, a need for more research and knowledge exchange events to share findings, experiences, good practices, and also strengthening systems around capacity building of education systems, and also a capacity building of institutions to implement, develop policies and programs through multi-sectoral and whole of system approaches. So basically transiting to how Africa Early Childhood Network is structured to support advancement of early childhood development on the African continent. Basically, AFCAN serves as a platform to champion excellence and collaboration in protecting children's rights, influencing policy and practice, strengthening partnership, and sharing experiences and knowledge in ECD. Basically, we support through 5 core programs, that is regional advocacy, strengthened partnerships, knowledge generation, improved practice, and also leadership development. Currently, AFCAN is privileged to support Africa Union Commission through the Early Childhood Education and Development Cluster, and therefore AFCAN coordinates partners' efforts in the realization of the Continental Education Strategy for Africa 2016-2025 objectives that are related to early years. And partners are encouraged to consider participating in cluster working groups through that link. So in terms of situating these cluster efforts, this underpinned by Agenda 2063 that calls for universal access to quality early childhood, primary and secondary education that ensures that no child is left behind. It's also drawn from the continental education strategy for Africa that identifies pre-primary education as a neglected subsector and that deserves special attention. And therefore, on 4th September 2018, the Africa Union launched the ECE cluster. And these are the objectives, basically to enhance policy, advocacy, and communication, the issue of intensification of action to improve equitable access to quality ECD programs, improving quality of ECD systems, programs, and services, improving governance and accountability, enhancing research generation, documentation, and dissemination, and finally, strengthening partnership and collaboration. So in terms of how we are structured as a cluster, the cluster is chaired by the Africa Union Commission with a co-chair from Government of Mauritius, and Africa Early Childhood Network acts as a coordinator and secretariat to the cluster. And therefore, to operationalize the cluster and further streamline operations, a technical committee and 4 working groups were established. And these working groups are policy, advocacy and communication, governance and accountability, access to quality ECD services, knowledge generation and dissemination. Each working group has a member state serving as a chair and development partner as a convener. The chairs and conveners of each working group, as well as the Africa Union Commission, AFCAN, together form the technical committee. So this is how we are structured, and stakeholders are encouraged to sign in as a member of one of the working groups so that we can engage and promote advancement of early childhood development across the African continent and also across the globe. Thank you. And basically, I've also provided some additional resources that members could maybe access to realize the same. So basically, as I conclude, there is a need for more advocacy to advance better investment in inclusive early childhood care and education, so that all children are given the opportunity to realize their full developmental potential, especially survival and thriving at the same time. Thank you so much. And over back to Maria. Thank you.
Well, thanks, Moses. Okay, cool.
Over to you, Katie.
We're gonna open the floor now for a couple questions for Victoria, Clement, and Moses. If you have any of those, put those in the chat or the Q&A. The first one we're gonna go with is for Clement and Victoria. The question is, might you be so kind as to comment on any approaches you may be implementing to engage fathers in support of greater family resources being dedicated towards nurturing care for mothers, infants, and young children? So there's that, and then Clement, if you could add to that and speak a little bit about your partnership with GPOs and other ways that you have addressed the needs of children with disabilities within the home-based ECD model. Victoria, do you want to start?
I think I can start. My answer is very short. To improve engagement of others, we are using well-known Promundo approach called MenCare. So we have adapted MenCare for many programs, including ECD, and it works wonderfully in many countries. So I think I'm putting the link to this question in a Q&A section as well. Link to this model from Promundo. Thank you.
Thank you, Victoria. If I go next, in terms of what you're doing as an organization to ensure the engagement of others in the support in the provision of services to children is there are several approaches that start with the whole mobilization of parents to join the program. We have special activities targeting the fathers through what we organize Father's Day around the model ECD centers and the groups of home-based ECDs, through that we recognize the well-performing fathers who are role models to their peers in an effort to mobilize them to join the program, but also because ECD, the group of parents around ECD are not just there for the ECDs, they are also organized for other different activities involving income generating activities and other kinds of activities that bring community members together. So through integrating multiple services into one, because our ECD approach has a strong family component, that also brings the fathers to the program. Thank you very much.
Thank you so much, Clement. We are now at the end of our discussion. It is all good things unfortunately come to an end. We are still opening the phones. Let's keep the questions coming in the Q&A section, and our panelists will be responding. We want to have a final session with you, all our participants. There is a link in the chat box from Menti that should be shared. Please click on the link, and we would like to hear from you by your answering the following questions. In your view, the following 3 actions should be prioritized in order for inclusive early childhood care and education to gain traction in GPE partner countries. When you follow the link, please rank the answers we provided. Thank you, and let's keep the questions coming. The link is on the chat box. Once again, I will take the question. In your view, the following 3 actions should be prioritized in order for inclusive early childhood care and education to gain traction in GPE partner countries. Please rank the answers we have provided. Thank you. Thank you for the responses. Let's keep them coming. There is a question for Aisha. Did you adapt the tool for different contexts due to language issues, or did you use the same questions everywhere? Is the tool adapted for children with disabilities?
I think our colleagues have responded, but I'll respond again. Yes, we did adapt for the context, but we didn't have any other adaptation. We basically used the same questions. It was just a contextualization exercise.
Thank you, Sosha. Once again, we will be sharing the recording from this session. Let's keep the responses coming in the Mentimeter. There is a question for all panelists. How do we bridge the gap from inclusive ECD being addressed in policy, but not in budgets or program implementation? Clément can respond to this question. Or any other panelist.
Thank you very much. How do you bridge the gap from including ECD being addressed in policy, but not in budgets or program implementation? This the first response to that is to ensure a coordination between the government, the private sector, and the civil society organizations, because most of the times budget allocation may reflect the amount of information that is available, the kind of awareness, the level of awareness the decision makers have has a very big role to play, but also getting the decision makers to understand the benefits that are in the investments in ECD also plays a big role in advocating for a fair budget portion to be allocated to ECD services. Thank you very much.
Thank you so very much, Clément. As we conclude our discussion today, the first response that we have found from the Mentimeter as the most popular response is capacity development of the ECCE workforce on play-based learning and universal design for learning. Thank you so very much for participating in our Mentimeter survey. Thank you all for your great questions. We are now going to turn over to Jennifer Rigg, the Executive Director for the Global Campaign for Education, US, for our closing remarks. Thank you so very much, all our panelists, Honorable Bimala Rai, Zacharias Dikai, Divya Lata, Sarah Osborne, Aise Kochak, Victoria Midalauri, Clément Kabiligi, and Moses Abiero. Thank you so very much, Kai, for being an excellent co-host. Over to you, Jennifer.
Wonderful, thank you. Can you hear me? Okay, perfect. Thank you so much for inviting me to join you all today. And please, everyone, join me in thanking our amazing moderators, in addition to all of the presenters that were just mentioned, and also to all participants, to all of you for your engagement and interest. Thank you to the interpreters, and a special thank you to Stephanie Pena, to all of the event co-sponsors and organizers, including the Africa Early Childhood Network, Catholic Relief Services, Early Childhood Development Action Network, GCE US, International Parliamentary Network for Education, Light for the World, Save the Children, UNICEF, World Vision, and again, all of you especially for your work, your interest, and your partnership. Many of you know I was born with vision disabilities and have children with learning disabilities. And so this topic is so critical, but it's one that impacts all of us. We are all truly impacted by these important issues discussed today. Inclusive early childhood care and education initiatives have a profound impact on children's development, affecting their learning, their lifelong education and economic opportunities, health, and brain development. As we prepare for the Global Education Summit next week, which will set funding in the education space for the next 5 years, investing in inclusive early childhood care and education is one of the smartest things countries and communities can do. During this event today, We have highlighted tools and have heard from policymakers and organizations that are shaping policy, implementing, and advocating for inclusive ECCE. We hope that this truly is just the beginning of the conversation, even though this will conclude our roadmap to inclusive early childhood care and education event today. Please do not forget to use the hashtag #InclusiveECCE for any social media coverage for today's event and also follow up and engagement with each other. And we also would really like to invite all of you to help spread the word and join, if you haven't already, the Inclusive Education and Early Childhood Community of Practice. Light for the World, the Global Campaign for Education, many of the groups involved today have wonderfully been bringing together advocates and civil society partners around the world through that community of practice. We'll share the link in the chat here and in the follow-up resources for people who would like to express interest. Thank you to all of you for your leadership, your advocacy and partnership to ensure that all children, especially including young people with disabilities, learn and succeed right from the start.
Thank you so very much, Jennifer. We end of our webinar. I'll leave it to Kylie for the final comment. Kylie?
I had a bit of a mute issue. I think this has been a really incredible space that we've shared today. Thank you for including me in this process. I hope that everybody has gained some perspective and shared some perspective, and most importantly, made connections, because this is how we're gonna move early childhood education and care forward, is by collaborating and working together across the globe. So thank you everybody for taking the time and sharing your knowledge and wisdom with all of us.
Until next time, goodbye.